Good morning, buenos dias. Welcome to this morning of community education and networking for Hispanic, Latino IBD patients and caregivers. My name is Lisette Gonzalez, and I'm a meteorologist for CBS News Miami. I work in the mornings and at noon, and I'm honored to be your moderator for today's event hosted by the Crohn's and Colitis Foundation. Now, I wanted to share a little bit of my personal connection as my daughter, who's 11 years old, was diagnosed with Crohn's disease about a year and a half ago. It was a very difficult time because although I have Crohn's in my family, my uncle had Crohn's. We didn't know a lot about the disease. And for her being 11 years old, for her to hear the news from her gastroenterologist that this was lifelong was really hard. And then on top of that, we find out that she has celiac disease. And although it was very challenging at first, we're grateful that we have a wonderful doctor and that there are medical options and treatments available. And also, I have to say, I reached out to the Crohn's and Colitis Foundation, and thanks to Katie for providing me with a lot of her advice and guidance and support. And now my daughter goes every 5 weeks for her infusions, and she's in a good place right now. But there are times where she'll ask, well, but mommy, why isn't there a cure? So as a mom and just as a person, I felt that I want to get as involved as I can with the Crohn's and Colitis Foundation because I feel that it's not talked about enough, and we need to bring more attention and awareness to these invisible illnesses. And I say that because at times you may see someone like even my daughter, and you may not think that she's dealing and battling with this disease, but there are so many people out there who are having to deal with IBD and Crohn's and colitis. And my hope and prayer is that not only do we find better treatments, and that would be by raising funds for research through events like these, through the Crohn's and colitis events that are hosted, but also that we can find a cure one day, right? That's really the mission. And so for me, it's very special to be here today to serve as your moderator. And I hope you enjoy the program because we have a lot of information for all of the Hispanic, Latino patients and caregivers. I'm Hispanic. My parents are Cuban, and I was born and raised here in Miami. So I love that the Crohn's and Colitis Foundation is hosting events like these. And they are committed to diversity and inclusion within the internal and external scope of the organization through education, support, advocacy. The organization is invested in ensuring diverse communities receive the latest IBD information and resources tailored to each population's need. This program is one of many events that we will be hosting. And we have a wonderful agenda planned for you this morning, which includes a presentation and a Q&A session. We ask that you hold your questions until the Q&A session, in which we will take questions from all of you. Before we get started, I would like to remind everyone that there are restrooms that are located just outside to the left down the hallway. You can feel free to excuse yourself as needed. And at this time, I would like to introduce our speaker and tell you a little bit about her, Dr. Stephanie Ioannou. We are delighted to have you with us this morning from the University of Miami Miller School of Medicine. Dr. Stephanie Ioannou, received her medical degree, completed her internal medicine internship and residency, and gastroenterology fellowship from the University of Miami Miller School of Medicine and Jackson Memorial Hospital. She spent her last year of her gastroenterology fellowship program focusing on inflammatory bowel disease, seeing patients in a specialized clinic. Dr. Ioannou will focus her clinical practice and research on inflammatory bowel diseases, Crohn's and ulcerative colitis, on the main medical campus in the Crohn's and Colitis Center in UMHC. Please join me in welcoming Dr. Ioannou presenting Together We Can, how to share decisions with your medical team. Thank you for being here with us this morning.
Hello, everybody. Good morning. Thank you to the foundation for having me here, and thank you for that kind introduction. So as was mentioned, we're going to be talking today a little bit about a couple of things this morning. We're going to be talking about IBD or inflammatory bowel diseases, ulcerative colitis and Crohn's disease in the Hispanic and Latino community. And we're also going to be talking about shared decision making. And while this talk is geared towards Hispanic and Latino communities, I think that this can be actually broadly applied to anybody with this kind of condition. And so I think hopefully my hope is that this will be applicable to everybody in the room. Okay. All right, everybody, we're just going to technical difficulties advancing the slides. There we go. There we go. We got it. Just want to say a special thank you to Dr. Cherabati for contributing to this slide deck. So first things first, let's talk about some numbers. Okay. So approximately 2.4 to 2.7 million people in the United States have inflammatory bowel disease. That's about 0.8% of the population. It's not an insignificant number. The incidence or the number of new diagnoses of IBD has actually increased by 39% in white populations and by 135% in non-white populations over the course of 40 years. Currently, about 234 people in the United States, that's 1 in 275 Hispanic persons, live with IBD. And it's actually estimated that that number will go up to about 300,000 by the year 2040. So this is obviously really important for us to be knowledgeable about and for our research to continue to expand in this population, especially because currently 19% of the US population is Hispanic, but that's rising every day. And we're expected to see that it's going to be around 30% by the year 2060. Here's another way to look at this. This graph looks at 1970 to 2010. You can see that both whites and non-whites have an increased incidence over the course of this time period. So new diagnoses being made of IBD in both populations. But interestingly, on the darker line on the bottom, you can see that that rate is actually rising more rapidly in non-white populations. So why is it important that we assess and understand IBD in communities of color? So importantly, disease characteristics and natural history of IBD is not the same in everybody. And we actually know that in communities of color, there are higher rates of things, for instance, like perianal disease and fistulizing disease. And so it's important that we as providers are keeping that in mind. We know that treatment responses may vary depending on the community that we're looking at. Health disparities within the community are important in terms of outcomes that we're looking at. There are barriers to accessing care, which we will talk about on the next slide extensively. And then healthcare utilization, resources, and other various factors also play a role in this population. So this is a nice depiction, I think, of some of the barriers to healthcare among Hispanic and Latino communities. Now, in general, we know and our data shows that IBD in patients from communities of color, IBD patients often present with complications and more advanced disease due to delays in diagnosis. And, you may be asking yourself, why is this the case specifically in this population? And we know that it starts even before patients are ever seen in the clinic. Some of the factors that I think are important to consider are, first of all, structural inequalities. Not everybody, is fortunate to live in Miami, which we love living here, but not everybody's fortunate to live in Miami where you can find a GI provider, on every corner and see IBD specialists easily or regularly. If you live in a more rural part of the United States, for example, it might be harder to have access to a GI provider, and especially somebody who's specialized in IBD. So that's one thing that is important to consider. Cultural beliefs are also really critical. We have heard a lot from patients that sometimes it may not just be the patients themselves, but family members who discourage them from seeking traditional health care when they have symptoms that arise. And maybe in lieu of that, consider things like herbal remedies or supplements to try to help their symptoms prior to diagnosis. Documentation status, as we all know, is also important and also contributes to things like fear in our patient population and delays in them seeking care due to concerns about being able to be in certain healthcare settings comfortably. Scheduling with all patients, but even with our Hispanic patients is obviously an issue, especially when there's a backlog. And then transportation challenges. Not everybody can easily make it to appointments, especially like we said in certain cities where the public transportation may not be as abundant. During the appointment, I think it's important to consider some things that, in fact, maybe the onus is on the provider. So things like, are interpretation services readily available in every clinic? And are the interpretation services in line with, with patients' ability to express themselves? What I mean by that is, for instance, a patient who is Cuban, who's using an interpreter that is from another country, maybe Venezuelan or maybe Argentinian, the way that they express themselves is not always the same. And so some of the ways that they're expressing themselves and then that getting translated to their provider, some things can be lost in translation there. And so that's something important to consider. And then on the provider side, there's provider bias. There's unfortunately still discrimination that Hispanic and Latino patients face in the clinic and outside of the clinic. And then there's a lack sometimes of cultural competency where the providers don't necessarily know how to address the patients and to understand their values and how they might differ from other patients. And then after the appointment, as everybody I think in this room has experienced, it's difficult to get follow-up appointments sometimes. It's difficult sometimes to deal with insurances and issues with insurance coverage for things like medications and procedures. It's challenging to make appointments and have time to be seen in the clinic in terms of, taking time off of work, for example, or finding childcare. So these are all things that we have to consider, and we consider them even more in our Hispanic and Latino communities just because we know that a lot of this contributes to delays in care. So then with all that being said and all that research that we have to think about what resources Hispanic patients tend to need or what resources they use. And so we actually have data that shows that Hispanic patients compared to non-Hispanic whites, so white patients compared to Hispanics, there's no increased risk or prevalence for hospitalizations in the Hispanic population. But in non-Hispanic Black populations, it's actually quite high, and there is an increased risk of hospitalization in those patients. And then when it comes to need for steroids at the time of their diagnosis, Hispanics are no different than whites. We've seen that in our studies, but we know that Blacks actually tend to need steroids more. And then when you separate it out and look at insurance, which actually may be a little bit of a better predictor of some of our communities of color, patients on Medicaid tend to need more steroids overall than patients with commercial insurance. So as a patient, you may be asking yourself, well, with all that being said, all these kind of numbers and all the research that we have about patients with Hispanic and Latino patients and patients in general, the community of color who have IBD, how can I approach my healthcare team about different treatment options? So first of all, something that I think is just important to stress is that in IBD, it's not always one size fits all. Your providers are using guidelines, national guidelines to help guide your care, but it's not always a cookie cutter type of thing where you're initially diagnosed and there's a very clear way of how we're going to treat you. A lot of it depends on you as a patient, and every patient is different. And so things that we consider are things like, do you have ulcerative colitis or Crohn's disease? How long have you had the disease? What is the extent of your disease? How much of your GI tract is involved? Do you have mild, moderate, or severe disease, for example? What kind of treatments have you tried in the past? Do you have other symptoms or other diagnoses that may be concurrent with your IBD that some of our medications can also treat? Like, do you have liver disease concurrent with your IBD, or do you have something like joint pains or severe back pain that might be related? And so all these are things that we take into account. So just important to keep in mind that it's not always a one size fits all, and every patient is individualized. So I wanted to give a couple of examples of treatment goals that you as a patient may have considered in the past. These are just a couple of examples, but this can expand to so many goals that patients have. So one goal that a lot of patients might have is to reduce their steroids. And anybody here who's been on steroids knows that the side effects of steroids can be really uncomfortable and really frustrating for patients. And a lot of patients don't want to be on steroids long-term. And as providers, we also want to make sure that our patients are being safe and not placed on steroids unnecessarily or for too long. So how can we achieve the goal of reducing steroids? The first thing that we want to do is we want to safely taper off the medication. So steroids can be dangerous if you stop them abruptly. So your provider should be providing you with a clear tapering guideline of how you can reduce the dose slowly to be able to get off of the medication safely. We're monitoring you as you're doing that because we want to make sure that your symptoms are not coming back too quickly and that we're addressing them if they do. And then we're thinking about next steps as well along with you, meaning as we're coming off of the steroids, what other treatments can we offer you as more chronic medical therapy so that you can be covered and be continuing to feel well, okay? And then an example of a second goal might be to try a new biologic to reduce inflammation. And that may be because the medication that you're on currently isn't working or it's not aligned with your goals. And so things that are important to consider when we're trying new biologics. For example, we want to be monitoring for side effects of the medication. Did you have a reaction to the new medication? Do you have an unwanted side effect that we should be monitoring for, that we should be adjusting treatment for? We're evaluating your symptoms as you're on the new medication, making sure that things are improving and not getting worse. We're assessing that you're not just are you feeling well, but that your endoscopies are looking good, that you're going towards remission or achieving remission with a healed intestine, right? And then we're also discussing and evaluating with you every step, your how you're feeling about it and what we can do to make sure that we're in alignment with your goals. So as a patient, you may ask yourself, what if my target is not reached? What are my options? And by target, I want you to think of that as like your goal. So, for example, we can be reviewing external factors and diseases that may be impacting how well a treatment may be working. So one thing to consider is, as a patient, are you able to take the medication that, we've started the way that we've recommended that it be taken? In other words, in the correct way, with the correct dosage and the correct frequency. And sometimes that's challenging. It may be that, you're scheduled for infusions every 4 weeks, but you travel a lot for work, and coming in for infusions every 4 weeks is not reasonable for you. That may be one example. Are you able to get the medication? Is your insurance covering it for you, and you're able to easily obtain the medication so that you can take it? So these are all things that we consider when it comes to impact of the way your medication is working. Now, adjusting treatments and continuing an individualized approach is also a very important thing to consider. For example, sometimes your medication is simply not working. We've given it a try for a period of time. We maybe adjusted the dose or adjusted the frequency, and it's just not the right medication for you. And so that might mean that changing medications is the right next step. And we like to be able to do that in conjunction with you by discussing what the options are and what the risks and benefits are of every medication, so that we're making informed decisions together. And then sometimes the target or the goal can't be reached, and it's just insufficient in the moment. And that might mean maybe the goal with a new medication was for you to be perfectly well, and you had some kind of goal in mind with that. But in the moment, that medication is too new and we can't reach that goal right now. But maybe we can help you feel better in the short term. For instance, we can keep you out of the hospital. We can avoid an unwanted surgery. And so sometimes we just need to adjust our expectations a little bit so that they're reasonable for the goal in the moment. Sorry about that. So goal setting and partnering with your providers. So important that you're setting goals with your provider and that you're communicating this at every visit that you have, okay? So discuss your personal preferences, and we've kind of alluded to this a little bit, but discuss how treatment will impact your life as a whole. In other words, is it going to impact you being able to go to school? Is it going to impact you being able to work or to travel if that's part of your job, for instance? Do you prefer a pill, for example, if that's an option for you, or an injection as opposed to an infusion, for a variety of reasons? So all of these are things that we need to be considering. Let's think also about short and long-term goals. And what I mean by that, for instance, is sometimes a short-term goal for a patient may be, I would just really like to improve the diarrhea that I'm having because I can't be getting up every hour in the middle of the night because it's affecting my work the next day, or I can't take care of my kids, right? And that might be a short-term goal. Let's get you feeling well enough that you can at least live your day-to-day life and be able to work, for instance. And then a long-term goal may be something like, I'd like to be able to attend my best friend's wedding in the next 3 months. I'd like to be able to travel out of the country or be able to go to a special event and not be worried about where the bathroom is or if I'm going to be able to make it there. So these are all important things to consider. And then, we talk about short and long-term goals, but we're also talking about healing for the future. And so in a lot of our patients, the future means things like family planning. How am I going to be able to, get pregnant if I'm, somebody interested in getting pregnant? Am I going to be able to do that safely on the medication that I'm on? And am I at a stage in my disease where I can feel like I can comfortably do that safely, right? That's one thing. The other thing might be people being interested in maybe going off to college. Maybe you're transitioning from high school to college and you'd like to be able to leave the state to do that. But are you at a place where your disease is well controlled and we can set you up with follow-up somewhere else so that you can do that? I even have patients come to the clinic and tell me, like, you know what, I'm retiring and I'd like to be able to go on a 3-month-long cruise in the Mediterranean. I'm like, great, that's awesome. Can I do that? Am I going to be able to do that and enjoy myself? So these are all things that we work towards. So then we've talked a lot about goals and about discussing goals, short and long-term goals and future planning. But what is shared decision making? Shared decision making is basically that the patients are actively involved in decisions about their care and their medical options just as much as the providers are. It's no longer providers making decisions for you and telling you this is what you have to do, but it's a shared discussion, okay? And we actually know through our data that the majority of patients and IBD providers, at least 80% of them, prefer a shared decision making approach. We know that there are benefits to shared decision making, such as increases in treatment satisfaction for patients being more likely or more able to adhere to their treatments because they've been heard, and also confidence in the treatment choices that they're choosing. This is a couple of pointers on how to engage in shared decision making with your provider. And I think these are all things that some of us can relate to if you think about yourself going into any medical visit. I think what happens sometimes is even though we say things like be open and be honest with your provider, that's not always easy to do. And a lot of times we come to visits anxious or we're stressed and we had all these ideas or things we wanted to talk about beforehand and you remembered them as soon as you left the office, as soon as you got to your car. So some things that we can recommend that you can do is you can talk to family and friends in advance, talk about things that you think are important and maybe get their perspective as well on things that they're maybe worried about for you that you can bring up with your provider. Write down notes. You can bring a piece of paper or put it on your phone and use that to jog your memory during the visit. And you can always bring somebody with you. If you feel more comfortable bringing a family member or a friend with you to a visit to help you, to support you, you're more than welcome to do that. And we very much support that. So how can you talk to your healthcare team about remission? So your goal, what I want to stress here is that the goal of the patient and the goal of the provider may seem different when you're discussing what our goals are. And we'll talk about that a little bit more in a moment. But ultimately, the path to reach both of those goals is generally the same. And that's where we're trying to get you to be at. So for your provider, the goals are, and we put it there in quotes, clinical remission with steroid-free mucosal healing. What does that mean? That means clinical remission, you're feeling well. You feel like you can live your day-to-day life and your symptoms are well controlled. You're not requiring steroids to be able to do that. And then you've achieved mucosal healing, which means on your endoscopy, you're also in remission. Your endoscopy looks good. There's no evidence of active inflammation on your endoscopy. So as your provider, that's always our goal. We want to get you to that place and we want to get you there safely and comfortably. And as a patient, your goal may not exactly sound like that, or that may not be exactly what you're thinking of, but all these goals that we've talked about having you feel better, able to travel, able to work, able to live your life, able to attend special functions, all of that goes hand in hand. And we just have to be able to make it there at the same, kind of in the same path.